Hi.
Hi,
Morning.
good morning.
Hi, nice to meet you.
Nice to meet you. How are you doing?
Fine, thank you. And you? Yeah.
I'm fine,
Yeah.
thank you. Please have a seat.
Yep. Well, as you may know now, I'm from the Civil Protection Department, and as we spoke last week, we are worried because there's a growing concern with regard to drowning-related deaths or accidents. This is shown by the latest statistics made by the government, but also by private organizations. And from the Civil Protection Department within my area, we're trying to tackle this issue. But since it's a complex phenomenon involving not only accidents related to leisure activities during the summer, but also accidents related to mafias working with irregular immigration. We are working in cooperation with the Ministry of Interior, with the police, but also we thought it would be convenient to work along with the Department of Education because some of those accidents are related to young people. So as I told you by phone last week, this is a very complex phenomenon. We know how to tackle this, but we thought it would be convenient to resort to as many professionals as possible, and we considered that it would be convenient to contact you as a professor and expert in ISO 31000 because then we could have a more comprehensive approach to solve this problem, or at least to minimize the risk and the deaths involving this issue.
Thank you very much for coming, and really I think that it's very important for civil protection and all the other ministries to get involved in this matter, because according to the World Health Organization, drowning is the third leading cause of unintentional injury death worldwide, accounting 7% of all injury-related deaths. There are over 230,000 annual drownings death worldwide. At the most risk of drownings, there are children, males, individuals with increased access to water. Drownings is a major concern for public health authorities, not just here, but all over the world, as the number of cases increases year on year. However, there is a lack of research or statistics, and outcomes are classified as death, morbidity, and non-morbidity. Drowning is a serious and neglected issue, public health threat in Europe and worldwide. And about the importance of statistics and data. Official data categorization methods are drowning exclude intentional drowning deaths, suicide or homicide, and drowning deaths caused by flood disasters and water transport incidents, according to the WHO. But data from high-income countries suggest these categorization methods result in significant underrepresentation of the full drownings toll by up to 50%. In some high-income countries. So it's necessary for the states to record the cases and provide good statistics, not only of the cases that end up in death. The statistics must distinguish between flood disasters, water transport incidents, where the age of the person, the cause, the consequence.
So given this context, statistics, reports, and so on, how could we proceed with the risk assessment?
So following ISO 31000, we are going to see now which are the main risk factors related to drowning. First of all, age. Age is one of the main risk factors of drowning, with children and the elderly being at higher risk. Gender, being male with an overall mortality rate that is twice that of females. Floods, which are and will become more frequent due to climate change. Waterborne migrations of migrants or asylum seekers, and as well we have increased access to water. And another risk factors are lower socioeconomic status, young children left unsupervised or alone with another child near water, alcohol consumption near or in water, medical conditions such as epilepsy, and tourists unfamiliar with local waters. Despite limited data, several studies provide information on the cause
impact of drowning, and there is an added relevant factor due to climate change. Flood disaster and higher temperature. Higher temperature suggests that more people will go to the water to refresh themselves. The experts pointed out that the ignorance, misjudgment of danger and disregard is a main factor linked to drowning.
So, talking about overall risk management, we can categorize it in relation to the citizens, from prevention towards general adults or specific groups, such as children.
Yes, children are surely a specific group and a target group that we like to work on because there was a peak in the numbers related to accidents with children and youngsters. So actually last summer was horrible in those terms, so we'd like to actually tackle that problem as soon as possible.
Yeah, I completely understand. Just in 2 seconds a child can be drowning and with fatal consequences. So children, we recommend for them compulsory preschool and a school curriculum on swimming, water safety and safe rescue skills, in fact in all the European Union member states, and a specific curriculum topics for children according to their area. For example, here that kids live very nearby the beaches areas, information about the flags. As well, we recommend regular school conferences for parents to raise awareness and control access to water, covering of fontaines, use of gates and playpens, fencing of swimming pools, and of course everything that is related to give a good training and good conditions to the lifeguards.
Thank you very much for this first thorough introduction to the topic and ISO 31000. I think we should schedule another meeting anytime soon, so let's check our agendas.
Yes, let's go back to the office. Thank you.